May is Mental Health Awareness Month, and we have had to go through a lot more challenges throughout the pandemic, most of them being stressful and overwhelming. And we have Dr. Dave Myers with bryan-health here with us today. And in terms of mental health, what have you seen over this past year?
Yes, the United States Census Bureau reported in December of 2020 that 42% of Americans are experiencing symptoms of depression, and that's an 11% increase from the year before. So we do know that the pandemic, COVID-19, is making an impact on Americans, and more Americans are experiencing symptoms of depression and anxiety. And we're seeing that across the board as far as folks taking more screenings, reaching out for more help, which is a positive sign that people are reaching out for help. But we do know that it's making an impact. And what that tells us is that mental illnesses are real, they're treatable, and we want folks to know that they're not alone, that there is help available.
And what are some of those ways that people can help cope with mental health problems?
Well, it's important to know that folks, is that they get connected, and connectedness is really the key. There's a lot of research shows that the more connected individuals can become, the less likely it is that they're going to experience those symptoms. So if individuals can do the things that they normally like to do, get connected with their family and friends, their community, exercise, eat right, eat balanced diets, sleep well. But if they find that they're having trouble doing those things, then it's important that they reach out to their family physician or a mental health professional and talk about the symptoms that they're having.
And why is keeping track of your mental health so important?
Well, there is no health without mental health. And so we spend so much time in our society focusing on our physical health that we really need to focus also on our mental health. So mental health and physical health together really creates a well-balanced individual. And so we really do need to focus on both of those things together, the mind, body, and spirit, so that we can become a whole healthy person.
And what kind of mental health services does bryan-health have to offer for the community?
Bryan Behavioral Health Services has a full continuum of services. We have one of the nation's only mental health emergency rooms that if somebody's in a crisis and they're not sure what to do and they think they might need mental health hospitalization, they can come to our Bryan West emergency room 24 hours a day, 7 days a week. If it's a non-crisis situation, you're not sure what services you might need, we have substance abuse services where you can take an evaluation. We have outpatient counseling. We have a whole host of services. You can call 402-481-5981 and we'll get you connected to those services. Or you can go to bryan-health.org and take an online screening for depression, anxiety, a whole host of mental health disorders. And from there, that will help you point you in the right direction.
All right, Dr. Dave Myers with bryan-health saying thank you so much for joining us today.
Thank you very much.
And we'll be right back with the recipe from the test kitchen. Don't go away.